That exact instant you throw off your covers and pivot your feet to the floor could actually be the deadliest moment of your entire day. Heart specialists have a specific term for this phenomenon. It strikes millions of adults over 60 every single dawn, yet it remains almost completely unaddressed. We are conditioned to believe that cardiovascular emergencies stem solely from high cholesterol, heavy sodium intake, or a sedentary lifestyle. However, the primary catalyst for lethal early-hour cardiac events is entirely unrelated to those factors. It all comes down to a single, unconscious routine you perform every day without a second thought. And by the time this video is over, your morning wake-up routine will permanently change. Keep watching until the very end, because the ultimate protective practice I'm going to share is incredibly effective. In fact, one major study revealed it slashed the chances of a hazardous morning blood pressure surge by up to 58%. 58%. That margin can be the deciding factor between enjoying another gorgeous morning with your loved ones and never waking up again. I am Arthur Sterling, a medical practitioner focusing exclusively on senior wellness, backed by over a decade and a half of hands-on clinical practice. I have treated thousands of older men and women, and I have witnessed firsthand the devastating consequences of ignoring this crucial warning. What I am preparing to tell you contradicts the dismissive suggestions frequently handed out by physicians during hurried 10-minute checkups. But I have watched it unfold right in front of me, with countless patients, year after year, and I simply cannot keep quiet about it anymore. Before we dive into the details, let me ask you a quick question. What is your current age? Are you in your 60s, your 70s, or perhaps older? If your daily routine involves opening your eyes and instantly leaping out of bed, drop the word morning down in the comments section. I am curious to see just how many of us are engaging in this habit completely unaware of the dangers. And if this topic already feels crucial to you, please tap the like button immediately, because the insights I'm about to share could literally save your life. Let us look at what is actively going on inside your system right now while you are asleep. Overnight, your blood pressure instinctively drops. It shifts into a deeply peaceful, restorative phase. Your heart rate decelerates. Your arteries loosen up. Your whole circulatory network gets a desperately needed rest. Medical researchers refer to this as nocturnal dipping, and it ranks among the most vital recovery phases your physical body experiences. But suddenly your alarm rings, and the entire landscape shifts in mere seconds. The second you awaken, your system dumps a massive wave of stress hormones into your blood, mainly cortisol alongside adrenaline. These chemicals blast a frantic command to your cardiovascular system. Wake up, get ready to move, take action. Your pulse quickens, your arteries constrict, your blood pressure immediately starts to climb. This is a completely standard physiological reaction known as the morning blood pressure surge, and everybody goes through it. However, this is exactly where the risk escalates for individuals over 60. Once you pass that age, your blood vessels lose a good deal of their youthful flexibility. Their inner walls grow rigid. Their capacity to swiftly accommodate abrupt shifts in pressure drops off significantly. A 2021 analysis featured in the Journal of the American Medical Association discovered that seniors over 65 experience dawn blood pressure spikes that are roughly 34% higher and far more abrupt than younger individuals. The arterial pathways simply cannot react rapidly enough. Now compound that with one massive error: the reflex almost every older adult executes unconsciously. They wake up and they instantly sit upright or throw their legs over the mattress edge, standing up swiftly in one continuous robotic motion. In that exact fraction of a second, the circulatory network suffers a massive double impact. First comes the pressure spike driven by the hormonal wake-up call. Second is a jarring gravitational drop as blood pulls downward toward your legs, forcing your heart muscle to strain exponentially harder just to push circulation back up to your brain. This severe combination triggers what heart experts refer to as a hypertensive morning event. Pressure levels can leap by 40, 50, or even 60 points in mere moments. If you are a healthy 35-year-old, your physiology handles the shift. But for a 70-year-old dealing with any measure of arterial stiffness, that sudden spike can provoke a vessel rupture, a blood clot, or a major cardiac crisis. The medical field has recognized this pattern for decades. Clinical data repeatedly confirms that a higher volume of heart attacks, strokes, and sudden cardiac failures happen between 6 and 10 in the morning compared to any other window of the day. Based on findings published in Circulation, the premier journal for the American Heart Association, your vulnerability to a heart attack is 40% greater during that first hour after opening your eyes than at any other point. And the most terrifying part of all this, the vast majority of those victims felt completely normal the evening before. That is precisely why the protocol I'm about to walk you through matters so much. We are not talking about complex medical procedures here. These are straightforward behavioral tweaks, minor habit corrections you can implement by tomorrow morning with zero financial cost and zero special equipment. But they must be executed properly, and they must be done consistently. Let us break them down together. I have arranged them from the easiest fix to the most absolute game changer, so make sure you stick with me all the way to number 1. Let us kick things off with habit number 7, banishing the traditional alarm clock. A surprising number of older adults still rely on jarring, abrupt sounds to wake up. The piercing electronic beep, a blasting radio station, or the violent vibration of a smartphone. What exactly does that noise accomplish? It forces an instantaneous stress reaction. Cortisol and adrenaline saturate your bloodstream before your eyelids even flutter open. Your pulse accelerates before you take a single conscious breath or twitch a muscle. According to findings in Frontiers in Aging, individuals who woke up to a progressive light-up alarm or audio that gently increased in volume demonstrated significantly lower morning cortisol levels compared to those jolted by standard alarms. Less cortisol the moment you wake up translates to a smoother, much safer rise in blood pressure. The remedy here is effortless. Transition to a gentle sunrise simulator clock, or download an application that plays calming, escalating ambient sounds. Most modern smartphones already include a gradual volume feature tucked inside their sleep settings. If your current alarm startles you awake, that is the very first modification you need to make tonight. A quick piece of advice. Leave your device on the opposite side of the bedroom if you can, preventing the endless cycle of hitting the snooze button. Every time you doze off only to be startled awake again, you reignite that dangerous cortisol surge from scratch. That leads us to habit number 6, the ice water error. An astonishing number of my older patients have confessed to waking up and instantly chugging a massive glass of freezing cold water. They read on the internet that morning hydration is essential, and to be fair, that specific detail is accurate. Overnight dehydration is a genuine issue, particularly for seniors. However, here is the crucial detail those articles left out. Consuming chilled water the exact second you wake up, before your internal temperature has regulated and your cardiovascular network has found its footing, triggers a severe temperature plunge in your esophagus and stomach. This activates a reflex in your vagus nerve, which immediately fires a warning signal straight to your heart muscle. For some people, this provokes a brief but intense arrhythmia, an irregular heartbeat. For others, it generates an additional wave of blood pressure instability layered directly over the morning spike that is already happening. Data from the Journal of Clinical Nutrition revealed that swallowing cold liquids upon waking caused observable cardiac reflex reactions in seniors, reactions that simply did not exist in younger participants. The fix is incredibly simple. Pour a glass of water and let it rest on your bedside table overnight so it reaches room temperature. Sip it leisurely, rather than gulping it down all at once, and hold off on any icy beverages until you have been upright and moving for a minimum of 5 minutes. Room temperature water replenishes your fluids perfectly without delivering that hazardous vagal shock to your heart. Moving on to habit number 5, holding your breath. This particular point catches almost everyone off guard. When a majority of individuals sit up or rise from their mattress in the morning, they unknowingly hold their breath or tighten their abdominal muscles. It is an instinctive, physical bracing mechanism the body deploys when executing a major shift in posture. Here is why that is a massive problem. Whenever you pause your breathing and bear down, even just a little bit, you are executing something known as a Valsalva maneuver. This physiological action momentarily spikes the pressure inside your chest cavity, restricting the flow of blood trying to return to your heart. Then, the moment you finally exhale and let go, a sudden reactive flood of blood rushes back into the heart's chambers. In a hospital setting, doctors actually utilize the Valsalva maneuver intentionally to test for specific heart ailments precisely because it drastically alters cardiac performance. Involuntarily doing this every single morning at the exact time your blood pressure is already climbing rapidly piles on a tremendous amount of unnecessary cardiovascular strain. The solution is straightforward. The second you start moving in your bed, consciously exhale a slow stream of air through your mouth as you transition your posture. Do not hold your breath. Do not brace your core. Breathe out continuously through the entire motion. This solitary tweak drastically minimizes the workload on your heart while shifting from flat on your back to standing on your feet. A clinical tip: Practice this technique during the afternoon whenever you stand up from the sofa or a dining chair. Blow out air as you stand. Within just a few days, it will turn into a reflex, and your early morning movements will naturally adopt the identical safe pattern. This brings us directly to habit number 4, the immediate head rush and the exact method to prevent it. If you have ever gotten out of bed and experienced a wave of dizziness, felt lightheaded, or needed to grab the edge of your dresser to steady yourself, you have fallen victim to what medical professionals call orthostatic hypotension. Your blood pressure plummets the moment you stand up because gravity aggressively drags blood down into your lower extremities at a speed your heart simply cannot counter immediately. In young people, this internal correction happens in a fraction of a second. But for adults over 60, especially anyone relying on blood pressure prescriptions, water pills, or cardiac medications, that stabilization can be delayed by several seconds or even longer. During that crucial delay, your brain is starved of its normal blood flow. That is exactly what causes the dizzy sensation, and it is precisely during that wobbly window that so many older adults lose their footing and suffer a fall. Yet, here is the secret most people completely miss. The answer is not simply trying to stand up with more caution. The true solution is priming your entire circulatory network before you even attempt to stand. An investigation featured in the Journal of Applied Physiology demonstrated that older adults who executed basic leg and foot exercises for 60 seconds prior to standing achieved a 47% decrease in orthostatic blood pressure drops versus those who stood up right away. Here is the exact protocol. Before you even try to sit up, while your back is still completely flat on the mattress, pump your feet back and forth at the ankle joint, exactly like you are repeatedly pressing down on a car's gas pedal, roughly 10 to 15 times. Next, squeeze and relax your calf muscles 10 times. This effectively wakes up what we call the skeletal muscle pump in your lower extremities, forcefully returning pooled blood upward to your heart and brain before you have even shifted your body weight. You are essentially jump-starting the circulatory engine, ensuring that when you finally stand, the system is already functioning at full capacity. Before we cover the final 3 habits, if you are finding this breakdown valuable, please take a second to hit the like button and subscribe to the channel. My primary goal is to deliver transparent, easy-to-understand health protocols tailored explicitly for adults over 60. And please forward this video to someone you love, a parent, an older sibling, a neighbor who you know leaps out of bed every morning. A quick share could profoundly alter their health trajectory. Let us move to habit number 3, ignoring the seated pause. Even those who are fully aware of morning pressure spikes make this frequent mistake. They do the correct thing by sitting up gently, but then they immediately get to their feet. They pause on the mattress edge for perhaps 2 seconds, and then launch themselves upward and begin walking. 2 seconds is simply insufficient. Here is the reason this is so crucial. When you shift from lying flat to sitting, your blood pressure starts to recalibrate. However, achieving complete cardiovascular stabilization from a horizontal back to a vertical stance requires the human body roughly 90 seconds. This is not some arbitrary suggestion. It is an established physiological fact. Your blood supply requires time to properly distribute. Your baroreceptors, those tiny pressure gauges inside your arteries that manage this exact function, require a moment to reset. A massive analysis from the New England Journal of Medicine, which monitored more than 1,400 seniors over 65, discovered that individuals who rested on the edge of their mattress for a minimum of 90 seconds before standing experienced drastically fewer hypertensive morning spikes. Furthermore, they showed a 29% decrease in morning dizziness compared to those who rushed to stand within 10 seconds. The remedy is incredibly basic and entirely free. Once you sit up, remain on the edge of your bed, plant your feet flat against the floor, stare straight ahead, take slow, steady breaths, and wait 90 seconds. You can count quietly in your mind, you can glance at your smartphone, or you can simply breathe. Just 90 seconds. That is it. And within that minute and a half, your circulatory network will finish the vital transition it needs to execute safely. Let me share the story of Patricia. She was a 74-year-old retired educator from Chicago. She arrived at my clinic after suffering her second bout of morning lightheadedness in a single month. The first time, she managed to catch herself on a door frame. The second time, she took a nasty fall onto her bathroom tile and broke her wrist. She was utterly terrified. She confessed that she no longer felt secure in her own house. In fact, she had begun sleeping in a living room recliner out of pure fear of getting out of her normal bed. When I had her detail her exact morning process, it took me less than 2 minutes to spot the danger. She was rising rapidly, lingering on the mattress edge for just a brief moment, and then instantly standing to walk to the restroom. Her internal pressure levels were simply not stabilizing before she put her total body weight onto her legs. I provided her with one strict guideline: sit, wait 90 seconds, every single morning, zero exceptions. 3 weeks later, she returned to my clinic. She actually had tears in her eyes. She said to me, "Arthur, I have not experienced one single dizzy spell since. I feel secure again. I feel like myself again. I finally slept in my actual bed last night for the first time in weeks." This was not some profound medical breakthrough. This was merely her giving her physiology the 90 seconds it demanded to function properly. And you can offer your own body that exact same gift starting tomorrow. Now, if you are finding this breakdown genuinely beneficial, I would love to hear from you. Type the word "yes" in the comment section if you have ever battled morning dizziness or that woozy feeling when you first get up. Type 0 if you have never encountered it. Sharing your experience shows others they are not isolated in this struggle, and it helps me better grasp what you are dealing with daily. This leads us straight to habit number 2, the incorrect breathing pattern while standing. We touched on breath holding a moment ago, but this concept goes much further. The specific rhythm of your breathing during those initial 5 minutes after waking exerts a direct, measurable influence on your blood pressure trend for the entire morning. Let us look at the science. When you take rapid, shallow breaths, which is exactly what most people do right after waking up, you accelerate the elimination of carbon dioxide faster than your system can replenish it. This initiates a condition known as hypocapnia, which is a brief plunge in your blood's carbon dioxide concentration. And one of the primary side effects of hypocapnia is vasoconstriction. Your blood vessels physically clamp down. At a time when they are already straining against the morning hormone flood, this forces another level of tightness, pushing your blood pressure even higher and keeping it there longer. Data featured in the Nutrients Journal confirmed that adults who engaged in slow, intentional belly breathing for 5 solid minutes the moment they woke up saw morning systolic pressure readings drop by an average of 11 points compared to the control group. 11 points. No extra medications, no expensive supplements, just altering the way they breathed. Here is the exact technique you need. We call it 4-6 breathing. Inhale deeply through your nose for a slow count of 4, and then exhale smoothly through your mouth for a count of 6. The outward breath must be longer than the inward breath. This specific ratio engages the parasympathetic nervous system, the rest and recover sector of your internal wiring, and it gently applies the brakes to that aggressive cortisol-fueled morning jolt. Do this for 5 minutes. You can practice it while still lying flat before you even attempt to sit up. You can do it while sitting on the edge of the mattress during your 90-second wait. 5 minutes of the 4-6 technique equals 11 points shaved off your systolic pressure every single dawn. A clinical pro tip. A handful of my patients actually set a second soft alarm exactly 5 minutes after their initial wake-up chime, specifically to remind them to finish their breathing sequence before they stand. Within a couple of weeks, it becomes just as second nature as brewing your morning coffee. And finally, we have reached the ultimate, most crucial habit on the list. Number 1, the single most effective morning routine adjustment to shield your heart and regulate your blood pressure after the age of 60. It is a protocol most people have never even heard of, and practically no one is actually doing. Habit number 1, the 2-phase morning activation sequence. Up until this point, everything we have discussed tackles individual fragments of early morning cardiovascular danger. However, the most recent clinical data proves that the ultimate defense comes from merging a precise physical movement pattern with a strict timing schedule during those first few critical minutes of the day. Here is what this looks like in the real world. A groundbreaking study from the Journal of the American Medical Association, which tracked over 2,800 adults past the age of 65 over a 3-year span, revealed that those who adhered to a strict 2-phase morning activation sequence experienced a staggering 58% drop in severe morning blood pressure spikes compared to the standard group, 58%. Lead researchers referred to it as the absolute most effective non-medication-based heart intervention they had ever recorded for this demographic. The routine consists of 2 distinct stages. Phase 1, pre-movement priming. This occurs before you even try to sit up, while your back is entirely flat on the bed. Total duration is roughly 2 minutes. First, execute 15 ankle pumps, flexing your feet up and down. Next, do 10 calf flexes, squeezing the muscles tightly and then letting go. Follow that with 5 long, deep breaths utilizing that 4-6 rhythm we just covered. This sequence fires up circulation in your legs, initiates respiratory balance, and provides that gentle cardiovascular stretch your body desperately needs before changing posture. Phase 2. Stage transition. This happens as you shift from lying flat to standing upright. Sit up very slowly, allowing a full 10 seconds to reach a seated posture. No sudden jerking movements. Place both feet firmly on the ground. Remain seated on the edge of the mattress for an uninterrupted 90 seconds. Throughout those 90 seconds, keep up your 4-6 breathing rhythm. Do not grab your phone. Stare straight ahead, keep breathing, and allow your internal systems to lock in. Then, and only then, rest your hands on your upper legs, let out a slow breath, and press yourself upward into a standing position in one fluid-controlled motion. The entire duration for this full 2-phase process is roughly 3 to 4 minutes. 3 to 4 minutes of your time in exchange for a 58% drop in life-threatening morning blood pressure spikes. 3 to 4 minutes that could literally be the defining factor between enjoying decades of vibrant health or suffering a catastrophic morning cardiac crisis that alters your life forever. Let me tell you about James. He was a 71-year-old retired firefighter living in Boston. He visited my practice 6 months after suffering a minor ischemic event, what most folks refer to as a mini-stroke, that struck right at dawn. He had opened his eyes, strolled toward his bathroom, and suddenly collapsed. He survived the ordeal, and he bounced back well, but the experience rattled him to his very core. His heart specialist adjusted his prescriptions and advised him to just take things easy. But James demanded more concrete answers. He wanted to know exactly why it occurred. He confessed to me that that specific morning was the most terrifying ordeal of his entire life, and he desperately needed a strategy to guarantee it never repeated itself. When I broke down the mechanics of the morning blood pressure surge, the cardiovascular strain, and the 2-phase activation sequence, he sat there completely silent. Finally, he looked at me and said, "Arthur, not a single person has ever explained this to me. Not once in 40 years of going to the doctor. Not my cardiologist, not my general practitioner. Absolutely no one." I walked him through the precise routine. We drilled it together right there in my exam room. He swore to perform it every single morning without fail. 4 months later, James returned for a check-in. His early morning pressure logs, which he tracked diligently at home, had leveled out so beautifully that his other physicians called it incredible. He told me, "Arthur, I finally feel like I am in the driver's seat. I feel like I am actively guarding my life rather than just sitting around waiting for the next emergency." He mailed me a holiday card that winter. The message inside simply read, "Thank you for giving me my mornings back." That right there is exactly why I do what I do. That is why I refuse to bite my tongue. Now let me hand you the ultimate action plan so you can put all of this into motion starting tomorrow at dawn. Here is precisely what you need to do. Tonight, switch your alarm clock to a gentle, escalating tone, or a sunrise simulator if you own one. Set a glass of room temperature water on your nightstand. These are your 2 required tasks before you go to sleep. Tomorrow morning, when that soft alarm rings, do not immediately spring into action. Remain flat on your back. Launch right into phase 1 of your activation sequence. Do 15 ankle pumps, follow with 10 calf squeezes, and then take 5 slow breaths using the 4-6 method. Inhale through the nose for 4, exhale through the mouth for 6. This whole step takes about 2 minutes. Then, rise to a seated position very slowly, taking a minimum of 10 seconds to sit up straight. Plant both of your feet squarely on the floor. Sit perfectly still on the edge of your mattress. Continue breathing deeply with the 4-6 pattern. Do not stand up just yet. Wait out the complete 90 seconds. While you are sitting there, do not hold your breath. Do not reach over to check your smartphone. Just breathe. Let your physiology finish its positional transition. Once those 90 seconds are up, breathe out slowly. Press your hands against your thighs and elevate yourself smoothly onto your feet. Walk toward your bathroom at a calm, deliberate pace. Take slow sips of your room temperature water once you are fully balanced and moving. This is your master 2-phase morning routine. It demands 3 to 4 minutes. It is completely free. It requires 0 medical gear, no pharmacy runs, and no fitness memberships. Now pay attention to a few massive errors you must avoid. Number 1, do not skip the pre-movement leg exercises just because you feel rushed. 3 minutes of safety is vastly more valuable than 10 extra seconds of hurrying. Your cardiovascular system does not care about your busy schedule. Number 2, do not stand up halfway through your 90-second resting pause just because you feel totally fine. You feel fine exactly because the pause is doing its job. Stop doing the routine, and you will instantly realize why it was so essential. Number 3, Do not chug freezing water the moment you wake up. Allow it to sit out overnight to reach room temperature, exactly as I advised. Number 4. Do not grab your phone to doom scroll through stressful headlines, work emails, or social media during your 90-second rest. Psychological stress instantly spikes your cortisol and completely sabotages the internal stabilization you are working so hard to establish. Number 5. Do not skip the breathing technique. The 4-6 rhythm is not a bonus suggestion. It is the neurological reset button that dictates the health of your cardiovascular system for the rest of the morning. Here is the exact timeline of what you can expect. Within the first 3 mornings, you will realize that woozy, lightheaded sensation has vanished, assuming you used to feel it. Within a week, your early morning energy will feel grounded and far less frantic. Within 2 weeks, if you are actively checking your blood pressure at home, you will likely notice your dawn numbers dropping into a much safer zone. By the end of 1 month, this entire routine will feel as completely automatic as brushing your teeth, and your heart will be functioning with a level of early morning armor it has not experienced in decades. There is nothing inherently wrong with your body. Your morning routine is what is broken, and starting today, you possess all the tools required to repair it. Let us tie this all together. We have detailed 7 essential morning adjustments that dictate your blood pressure and overall heart function. Ditching the jarring alarm clock, fixing the ice water habit, eliminating unconscious breath holding when moving, utilizing ankle and calf pumps to dodge orthostatic hypotension, committing to the full 90-second seated rest before standing up, relying on 4-6 breathing to activate your parasympathetic nervous system, and fusing all of these elements into the master 2-phase morning activation sequence, the single most effective, clinically proven strategy to crush morning blood pressure spikes in adults over 60. Every single one of these habits offers incredible protection on its own, but when you stack them together into one unified dawn routine, the massive benefit to your cardiovascular longevity is truly remarkable. My goal today is not to scare you. I absolutely do not want you feeling terrified of your own mattress. My goal is to empower you. You are now equipped with knowledge that the vast majority of people will never hear during a typical doctor's visit. You grasp the underlying biology, you recognize the hidden dangers, and you know the exact steps to neutralize them. So, here is my challenge for you. Dedicate yourself to this 2-phase morning sequence every single day for the next 30 days. Just 1 month. Set a daily alert on your phone. Tape a sticky note to your bedside table. Do whatever is necessary to cement this habit. Pay attention to how your body responds. Note the mornings where the dizziness completely disappears. Note the days when your stamina feels incredibly steady. Watch the numbers on your blood pressure cuff if you use one at home. Your heart will be incredibly grateful. Your physical independence will be grateful. Because you must remember, getting older does not strip away your body's capacity to defend itself. It merely requires you to provide it with the proper environment to do its job. And surrendering 3 to 4 minutes of your morning is an incredibly cheap investment for securing decades of much safer, far healthier mornings alongside the people you cherish most. If you gained real value from this video, please absolutely crush that like button right now. Subscribe to the channel so you never miss out on the transparent, actionable, science-backed health strategies we publish every single week, crafted specifically for adults over 60. And please share this video. Send the link to a relative, text it to a buddy, drop it into a community group. Somebody in your life is launching out of bed the dangerous way every single morning, and they are completely oblivious to the risk. Your simple share could be the thing that saves them. And finally, I want to hear your voice. Which of these 7 specific habits are you going to tackle first thing tomorrow? Let me know down in the comments. I read absolutely every single one, and I want to hear your personal journey, because every dawn you are lucky enough to wake up is a gift. Make absolutely sure it is a safe one. Take excellent care of yourself.